what I love about the energetic model is the idea of prevention. So if you have a symptom, I have PMS, I have fibroids, I have endometriosis. These are signs of a hormonal balance. Any sign that you have in your ovaries or your womb is a sign that there could be a sign here later. There could be a problem here later. Does that make sense? So you wouldn't have a problem here. You wouldn't have a problem here unless you had a problem here. But in Western medicine, we get a sign and the doctor says, take this pill. But it doesn't go to the root of what's the imbalance that causes that sign. And the analogy that I love to use here is your car. If the light goes off in your car and you go to the mechanic and the mechanic says, why don't we just pull that fuse if it's bothering you? You'd be like, you are such a loser mechanic, I'm not going to stay with you. But that's the way we look at our bodies here. We're just masking a symptom with a symptom, and usually the medication causes a different symptom for which there's medication.
Right.
It's sort of an insane model in that way. But on the other hand, the diagnosis in Eastern medicine is all subjective. You know, pulse, tongue, face reading, you have to rely on the clarity of the practitioner. You could get an MRI or thermography or a mammography, and you have to depend to some extent that the practitioner is competent, but that's giving you a good picture of what's going on. So there's good things in both camps. I wouldn't go to, you know, an acupuncturist if I broke my leg, right? I would go to Western medicine. There's time for both. In Eastern medicine, you're looking at how things work in terms of how they relate to each other. So it's trying to look at a bigger picture. In Western medicine, we try to break things down to the tiniest molecule in order to figure out how they are. But I'm not saying one is better than the other, but what if we actually looked at both directions and got a more global picture? Does that make sense?